Dear colleagues, it is an honor to join the annual general meeting of the Canadian Partnership for Women and Children's Health. Your commitment to our collective mission, promoting innovative solutions to improve health outcomes for women and children worldwide, could not be more relevant or more vital. As we continue our bumpy journey toward a post-pandemic world, those of us advocating for every person's right to make decisions about their bodies and futures are operating in increasingly complex environments with multiple crises intersecting and creating new challenges. It doesn't escape me that I'm addressing you on the day that the world reaches a population milestone. Today, the world has officially reached 8 billion people, with a projection to surpass 9 billion by the middle of the century. That is 8 billion people who deserve not just to survive, but to live well and thrive, and who deserve bodily autonomy and the resources to make decisions that are right for ourselves and our families. Such a milestone in human development raises old questions about the consequences of rapid population growth rates for all countries, and particularly for low and middle income countries. It doesn't escape me either that I'm addressing you as many of us meet for the first time in person at the International Conference of Family Planning in Pattaya, Thailand, to discuss the current state of the global movement for family planning after the pandemic. Events affecting the world in the last 2.5 years have threatened to undo decades of progress in sexual and reproductive health outcome, particularly for those living in the poorest countries. In 2020, Guttmacher reported that the rate of unintended pregnancies worldwide had fallen since the 1990s, mostly due to increases in contraceptive use. That was a positive development. However, we also noted that the progress was limited, unequal, and uneven. Our estimates for 2015 through 2019, before the pandemic, show that women in the poorest countries experienced unintended pregnancy rates that were nearly 3 times those in the wealthiest countries. We also found that unintended pregnancy rates are highest in countries that restrict abortion and lowest in those countries where abortion is legally permitted. This means that many women and girls seek abortions in settings where it is rife with legal risk, it's highly stigmatized, and it's potentially dangerous. We published these findings in March of 2020, just as COVID-19 was beginning to transform the world as we knew it. Because of the inequities our research pointed to, it wasn't difficult to predict the negative and disproportionate impact that global response to COVID-19 would have on vulnerable populations around the world. It wasn't that difficult to foresee that mobilization of financial resources for the COVID-19 response, while vital, would take essential funding away from reproductive health programs and decrease access for patients who relied on free and subsidized care. Not to mention the devastating impact that the pandemic would have on health systems, on the flow of medical supplies and commodities, such as antiretrovirals for HIV and AIDS, antibiotics to treat sexually transmitted infections, and contraceptives to prevent unintended pregnancies. There was also an effect on the waiting times for people seeking sexual and reproductive health care. We knew that burden was going to be distributed unequally across the world and across the world's health systems, in many ways that reflected and exacerbated pre-pandemic inequities. As the pandemic went on and wreaked havoc, we conducted a scoping review of the information available to identify, to map, and to synthesize studies on its impact on sexual and reproductive health in low and middle income countries. Specifically, we set out to measure the impact of COVID-19 on the demand for, provision of, and access to contraceptive and abortion-related services, and the reproductive outcomes of these impacts. Our researchers searched bibliographic databases, reviewed key emerging literature, including 71 studies from across developing regions, covering the time period from December 2019, which is right before the pandemic, through February 2020, roughly about a year after the pandemic started. What we found is critical information for advocacy and policymaking. It was also a sobering confirmation that historical injustices yield present-day adverse consequences. Overall, the COVID-19 pandemic has had substantial effects on people living in low and middle income countries, particularly in the early months of the pandemic, which further weakened fragile health systems. Nearly all the studies assessing changes over time to contraceptive service provision noted declines of varying magnitude. Overall, studies found increases in demand, while there were reductions in provision and increases in barriers to accessing these services. And the use of abortion services also declined. We also looked into access to contraceptive services among adolescents during the COVID-19 epidemic and confirmed that the pandemic has taken us essentially from bad to worse. Our estimates illustrated the devastating impact that declines in essential sexual and reproductive health care could have for adolescents in 132 low and middle income countries. Many of our research findings are closely aligned with the lessons captured in CanWaCH's timely report, 100 Days of the Pandemic. Among the key insights that struck me when reading that report, two caught my particular attention. The risk that crises like COVID-19 pose to giving rise to misinformation, and the risk of radicalization and discrimination, specifically noting that scapegoating drives vulnerable communities underground. Indeed, we've seen a growing movement to undermine public health by sowing confusion and misleading the public. And we see the malignant effects of misinformation and disinformation. In the United States, a decades-long misinformation campaign played a large role in undoing of Roe v. Wade earlier this year. This campaign was often entangled and embedded with the policies that burden people of color and people who are poor. There are many reasons to be concerned that the undoing of Roe v. Wade will reach far beyond the United States. And of course, international organizations and policymakers are concerned that the rollback of legal protections for abortion in the United States could strengthen efforts in other countries to prevent or even reverse abortion law reform and could endanger access to abortion services. However, it is somewhat encouraging that the US Supreme Court's decision notwithstanding, the overwhelming international trend is toward expanding abortion. It's important to remember that the US is an outlier, an unfortunate outlier in this effort. If countries continue that trajectory by combating misinformation with facts and enacting evidence-based policies to supporting sexual and reproductive rights, they will avert the many harms that women face when they are denied bodily autonomy and denied access to quality, comprehensive sexual and reproductive health care. The global and sexual reproductive health and rights situation is one that we will continue to monitor, to study, and document closely. Equipped with the evidence, how do we collectively work to rise to the occasion and meet the needs of this moment and forge a healthier future? We believe that collaboration, integrity, equity, and justice are essential to finding the solutions to many of the global sexual and reproductive healthcare issues we face. We can still arm ourselves with comprehensive plans to prioritize sexual and reproductive health rights and justice across the world. We can support individual rights to decide if and when to have children, to provide essential health services, including access to contraception and to safe and legal abortion. Investments in high-quality research and tireless utilization of evidence to inform advocacy and policymaking are critical to combating harmful misinformation and disinformation. I encourage all of you to take a look at the Guttmacher Lancet Commission report, which provides a comprehensive, evidence-based, bold, and actionable agenda for key sexual and reproductive health and rights priorities globally. The commission was an international collaboration that brought together 16 experts with multidisciplinary experience in a broad range of sexual and reproductive health rights, experts from Africa, Asia, Europe, the Middle East, North and South America. The commission's agenda offers a comprehensive definition of SRHR and a key guide for stakeholders in designing policies, services, and programs that address sexual and reproductive health and rights effectively and equitably. An impressive number of governments, such as Sweden, the Netherlands, South Africa, Mexico, Ireland, Portugal, the UK, and Ethiopia, have embraced this definition, either by adopting it in its entirety or by using the government departmental planning and positions on sexual and reproductive health and rights. Likewise, adoption of the essential package of interventions, particularly neglected interventions, will eventually result in wider availability of sexual and reproductive health services and greater realization of reproductive rights at the country level. The uncertainty and volatility we have witnessed in the past several years continues to present enormous challenges and serves as a clarion call for action. A clarion call for all of us to rise up. A clarion call for none of us to back down. A clarion call to effect transformative change. At Guttmacher, we talk about our work as uncovering facts for the fight. At this conference, I join you all in answering the clarion call for all of us to fervently fight for the facts. Thank you for your support and work towards a more equitable and just world for all people.